Okay, so welcome to the annual general meeting of the Buckinghamshire Healthcare NHS Trust. We have had some technical issues, so you will not be receiving this live. You should be watching a recording of the annual general meeting. I'm David Knighton, I'm the chair of the trust and chairing the general meeting today. This is relating to the fiscal year 2024-25, to which the annual report relates. And I think as a trust, we had a good year in terms of being on an improvement journey in many of the areas in which we operate. And there have been some really quite strong performances in some areas which we should be proud of. And I wanted to take the opportunity to thank all our staff for the efforts they've made during that year. Amongst other highlights, it was the 80th anniversary of the National Spinal Injury Centre. And we had the Duke and Duchess of Edinburgh visiting us to celebrate that. We've won some awards for the use of AI in how we deal with patient complaints and having a much more enabling us to have much more understanding of some of the issues that we need to address. We had very successful lipid optimization program improving cardiovascular health, and that will continue. We've had a good year in health on the high street in Aylesbury, and we're looking to extend that into Wickham. And we've recently been awarded one of the 43 national neighbourhood pilots to work on as one of the key points of delivery of the government's 10-year plan. So it was a very difficult year in terms of pressures, not least because of the extensive industrial action taken during that year. Thankfully, New Year, we have had only one piece of industrial action. We're all very hopeful that that doesn't recur again this year. That will enable us to continue the level of improvement forward. I'm not going to say too much more because John and Neil have got a slide deck that will cover more of the period. But I just did want to take the opportunity to say our thank you to Neil, our Chief Executive. This is actually his last day today. He's got house movers at the weekend and is moving to take up the role of Chief Executive at Plymouth University Hospitals. And Neil has been with us 12 years, the last 7 of which he's been our Chief Executive. And you can tell from our staff survey results and staff well-being that his approach to staff, his openness, his transparency have all played a significant factor in making the trust a great place to work. But also he has interacted really positively with the council. He's been the vice chairman of the council's health and wellbeing board, chairs the Bucks executive partnership, making Bucks as a place to work together really well. And therefore, you know, in great depth for the legacy he leaves us. Our Chief Operating Officer Raghu will be taking up post as interim CEO. Technically in about 2 weeks' time, but he'll be acting up until he formally takes up the post. And we just wanted to take this opportunity publicly to thank you. Without further ado, I will move to the important issue of the money and ask John Evans, our Chief Financial Officer, to take you through that.
Thank you, David. So I'm John Evans, Chief Finance Officer here at Buckinghamshire Healthcare. So here to give a report and rundown of our financial performance last financial year. That's the financial year 2024-25. I'll talk a bit through our performance across income and expenditure, across capital, and then give a bit of a pre-scene on the plan that we've agreed are in the process of delivering for the 25-26 financial year, and then a round off for our charity. So I'm pleased to say that our financial performance over 24-25 was a really positive one. We delivered a slightly better than financial plan performance. So we had a plan to deliver a small deficit, £0.7 million. We actually delivered a small surplus of £2 million, so slightly better than plan. That is the second year running that we have committed to and delivered the financial plan that we agreed at the start of the year. And in the context of our ICS overall, that's the Buckinghamshire, Oxfordshire and Berkshire West integrated care system, that delivered an overall worse than planned performance of about 15.5 million. We kind of stand out a bit around that in doing what we said we were going to do. That's against the backdrop of some quite challenging issues operationally. You would have seen in the media across the whole of the last financial year the quite significant impact of industrial action. That's around us covering the cost of shifts and ensuring the trust ran in a safe manner for our patients, but also the lost activity from not being able to operate or provide services to the scale that we normally would during that time, and also the unavailability of our theatres estate because of challenges around them being able to be usable, and again lost activity that quite significantly impacted on the amount of income that we received for those services. So in spite of those challenges, and the fact that the rules that we were operating in particular towards the end of the year on how we were paid for that elective activity changed quite significantly by NHS England, we still managed to deliver a slightly better than planned performance. So that was because of two reasons. One, our quite strong focus on resource controls. So that's where we focused on reducing waste, improving our efficiency, and overall improving productivity. And you'll see in the content that we improved our productivity steadily again, and to a position that was better than our national average. So we improved our productivity last financial year, 24-25, by about 8%. Nationally, that improvement was 3%, so quite a significant achievement. That's meant that we've been able to create capacity and treat more patients and provide better access to patients earlier than we otherwise would. So there are real world kind of implications for this. And this continues to be a focus, kind of in particular, the recovery of productivity versus our 1920 pre-pandemic benchmark, of which we're pretty much in line with where we were pre-pandemic. Nationally, we're about 8% lower. So a big thanks to colleagues that have worked really, really hard to work on redesigning our services, remove waste and improve access for patients that have contributed to that financial performance across income and expenditure. On capital, we had another bumper year for capital, not quite as bumper as the year before, but we had capital spend of circa £36 million. That's about £10 or £15 million more than the allocation that we would normally receive as part of our system allocation. We were successful again in kind of bidding and receiving additional monies that we've spent in particular across our EPR and our digital journey, so that we can update and make fit for purpose the digital systems that we have available for us to improve the quality of data, to improve the quality and real-time nature of decision-making across the organisation. We opened up our emergency medical receiving unit on the Stoke Mandeville site. That's a new ward that helps support flow for patients coming through an urgent and emergency care pathway. We continue to invest and are nearly completed our further investment in our Wickham site around the energy centre, which is around decarbonising our footprint and will reduce the costs of heating and lighting this site. We continue to invest in critical infrastructure, part of that around the challenges that we've got around theatres, but also the wider estate and non-PFI estate, and continue to invest quite heavily in increasing diagnostics capacity so that we can speed up the access to and then diagnosis of treatments to get patients on the appropriate clinical pathway as quickly as possible. So we spent all the money that we had available to us, spent a little bit more, in fact, by about £500,000, given an agreement that we had with wider system colleagues on underspends elsewhere. And then we landed the position at year end in cash with circa £20 million as a cash balance. So a positive position around cash by year end. If we move into this financial year, it's quite a challenge this financial year. I don't think I can say anything other than that. The scale of the planning assumptions that we were asked to work to and work with are kind of a scale that I've not seen in my 20-year career in NHS finance. The scale of efficiency requirement as mandated to us, the scale of financial recovery back to a near break-even position, again, not of a scale that I've seen in my NHS career, if I'm being completely honest. That's around us getting the NHS back to a sustainable financial footing. We've committed to a financial plan that requires us to deliver a scale of efficiency and financial improvements beyond which I think we've delivered on in this organisation for a very, very long time. That's not dissimilar to what's being requested across the rest of the country. And this is all about how we put ourselves in a place where we can create some headroom for further investment that you will have no doubt seen around the public announcement of the 10-year health plan. And it's about putting ourselves on a firm financial footing so that we can create headroom to invest in the 3 shifts that you will have heard announced publicly by the government. This is a challenging situation, one, because we are starting to see the impact, albeit it's relatively small, around the impact of industrial action. The scale of things that we would normally look at to improve or create kind of turnover in our workforce. We will be a smaller organisation when it comes to the size of our workforce at the end of the financial year than at the beginning, partly to save the money, but to deliver our overall operational plan. And we are seeing, one, a reduction in kind of turnover as opportunities for colleagues to move on to other organisations is reduced, and seeing the kind of the squeeze on the other things that we're working on in terms of large scale organisational change, these options being reduced. However, the challenge that we have is the challenge that we're rising to, and we're working through how we de-risk and deliver the financial plan that we've committed to delivering as part of our integrated care system. Capital, again, another fun year, quite significantly greater than it was last year. Again, one of the largest years that we will have seen in this organisation. We've been successful in bidding for 2 pots of money, one around investment into our Wickham site, quite significant down payment on the redevelopment of the Wickham site, and also around investment into supporting critical infrastructure and investment in backlog maintenance. So one, as I've said, kind of availability of our theatre capacity, but also about improving the general infrastructure of the site so things don't break, and so that they're replaced in good order so that they are more resilient. I think we've been quite fortunate in negotiating that money. Clearly, the challenge for us now is to spend that money in good order and in a value for money place, that you'll see throughout our board reports on how we spend that through this financial year. And then, kind of given the cash position that we landed on last year, and given the financial plan that we set for ourselves this year, we are not expecting that cash support is required. There are a number of organisations that already nationally are looking for cash support, given the challenging financial situation that we're looking at, but we're not looking for that to be the case kind of when we deliver the financial plan this year. That's kind of a bit of a recap. Very challenging financial plan this year. It is challenging nationally. I'll kind of explain the context as to why that's important. And then for our charity, so the Buckinghamshire Healthcare NHS Trust Charitable Fund, of which I'm very pleased to be able to sit on our Charitable Funds Committee. We received income for the 24-25 financial year of about £1.2 million. We spent about £1 million of that. We continue to invest across activities in patient welfare, around staff welfare, and across a variety of other programmes. And I think we're starting to see some real benefit as we start to track through those investments and to help and support in particular programmes of work that the trust isn't able to support and the charity is. I need to continue to raise and thank the significant support from our partners at ScanAppeal, who continue to benefit from their donations in the last financial year, and indeed have been able to accept an award-winning Room to Breathe hospital garden that's been donated from the Chelsea Car Show for our Amersham site. We're currently still accepting donations. That's been relocated. So please, if you feel able to go onto our website or go onto ScanAppeal's website to be able to donate there to make that investment in our Amersham site for our patients there a much needed reality. And then again, continue to receive support from national NHS charities together. So big thank you to all of our charity partners in being able to make some programmes work that would otherwise wouldn't be able to do. I'm going to stop there and pass over to Neil, our Chief Executive.
Hello everybody, Neil McDonald, Chief Executive. So I'll just give a few performance highlights for the year 24-25. So on all our kind of constitutional standards, I'll probably start with the work that colleagues have done to significantly reshape and remodel pathways to our emergency services, both out in the community, in the front door of our services, which are the residents' front door, but also particularly through the state management site across the emergency floor. The improvements from which resulted in us being awarded £2 million of additional capital at the end of last year. Was one of the top 10 most improved organisations, which is allowing us to continually invest in some of those facilities which are currently underway. In terms of reducing our overall planned care list, some good progress in terms of meeting statutory requirements last year. Eliminating those very long waits, and still quite a significant way to go in terms of returning our waiting times back to as they were pre the pandemic times. I'd also just like to pull out the waits that are less reported and less visible, but sit out in our community services, particularly for children. Children clearly being one of the most important staff in the waiting times for kids waiting to go into our community paediatric service, but also to note that in our acute paediatric service we are 18 compliant in terms of providing access to outpatients. And then in cancer we continue to contend with, in some areas and some tumour sites, about 30% growth in demand. We continue to work through making our pathways more efficient, our capacity expanded, and using technology to make improvements in there. I would reference the improvements we've had in terms of our imaging and diagnostic infrastructure, particularly the implementation of the new quality management system, and strong reference to new scanners at the Amersham diagnostic site, and further to what we provide at various sites this year as well. On the next one, Joe pointed on the quality and patient experience, which I want to thank particularly Raghu, Andy and Jenny for their leadership in this space. This is just a snapshot of some of the improvements and reporting we do. I would urge people to read through our quality account that was published a couple of months ago, which gives a much more in-depth view of the quality of care we provide. Especially to the end of June this year, we have the 6th lowest risk-adjusted mortality ratio in the country, which is a great recognition of the quality of clinical colleagues we work with, but also the many colleagues that go in to support them. And then I would also reference our kind of new embracing of technology to get greater insight into what our patients and residents are saying about the quality of care, and I think the voice of the patient, particularly in terms of how they access us, talk to us, interact, are communicating with us, will be of even greater importance. Something I know which is of personal passion to the incoming Chief Executive, and has been subject to conversation around the table. We've heard presentations about particularly about patient care and some improvement that we can in that space. For the people who work here, I thank you, David, for very kind words at the start of this general meeting. By far the most pleasurable, rewarding, satisfying part of my time here the last 12 years has been the people that I've met and had the privilege to work alongside. I'm really proud with Bridget and other colleague leadership, the emphasis we've had on protecting what is our most important asset, as you would anyone protect their most important asset, which is keep them safe, look after them, provide the environment in which they can do their job, which we always strive to do more and to be better, but we can be confident that this is people who want to come and develop their careers, work in healthcare, and make a difference to people, and work alongside some great colleagues. This is one of the best places in the country to be able to do so. And then finally, again, I just want to make tribute to the work we've done over the last year in 24-25 on developing our overall strategy. We published our 10-year plan, a couple of months ago. National 10-year plan was done, and we did so through work over 24-25, led by Duncan's team and others around pulling together key partners across the health and care system, set out a coherent framework which will become the health and wellbeing strategy for the county of Buckinghamshire, because we understand with the realities of the growing inaffordability of healthcare driven by increased costs of technology treatments, but also demographic changes, meaning that the solutions to those sit out with purely the health service to resolve. When we look into our building communities, building housing, building education, giving people the best start to life and so forth, and then tackling some of those underlying causes of ill health in the more preventative approaches. David alluded to some of those programs at the start. A piece of work that I would encourage the public to read and to come back to time and time again in terms of holding these brought to account in terms of delivery of those better outcomes for residents. Supported, of course, again, as John referenced, by some really significant investments into our digital infrastructure. We finished a long programme of core infrastructure required to build on that as a network and cyber capability, on which we are now layering our electronic patient record, which started implementation in 2025 and continues through this year, which is essentially getting that information that we hold about people from paper onto data to be much more targeted and specific in the work that we do for all. And then finally, investing in our buildings, again, as John's reference to, but significant changes to how we provide modern healthcare facilities, particularly on our two main acute sites, carry out some much needed remedial work, but also some building some new facilities for the future. So that is it from me. I think I'm going to video.
Over the past year, Buckinghamshire Healthcare NHS Trust has accelerated changes to meet the healthcare needs of its residents, focusing on improving services and ensuring they're delivered by the right professionals at the right time and in the right place.
So the ethos is that we want to see patients, we want to make sure that they are in the right place, get the right care by the right people, and that we do it as efficiently as possible.
You'll have your initial assessment, but often we'll discharge from there. They get referred on quickly to the appropriate team or to the appropriate assessment area. So again, you can decongest a bit of ED if you need to. The patients get seen in a timely manner by the most senior person within the department. And so what was important for us was actually to make the journey as kind of short and focused as it needs to be. I think that's what we've managed to achieve really well. What has been really helpful with Flow is the emergency medicine receiving unit that opened up at the end of last year. I think our revolutionary thing that we've done different to everybody else is the way we introduced a CDU clinician. In CDU, for example, before we started this new process, you used to get 15 to 20 at the very most patients in a day. We're now getting anywhere between 40 to 70. So really significant amount of flow.
We have now started amalgamating far better into the emergency care pathways, the the kind of exit strategies out of ED. So hospital at home, the birth team, which are looking after their patients with respiratory problems and oxygen, home oxygen and so on. And then the frailty STEC team and the kind of frailty hospital to home, MUDAs, all of that. We have the REACT service where we have autism physios are assessing patients who are elderly and making sure that they're safe to be discharged home. And all of that as an integrated multidisciplinary team means that we don't have to admit all the patients to hospital and we can manage them at home. And that actually has made a big difference.
For us, having patients send in so many compliments, you know, you'd have all these complaints. Our complaints have gone down by about 30%, which is great. But the number of compliments that I get thrown at us from the governance team is just so nice.
The service was set up because so many people were coming into surgery not ready for their surgery. So many people were coming, there was cancellations on the day for high blood pressures, out of control diabetes, things like that. And a lot of people with quite high inflated BMIs or low BMIs that were a risk factor when coming in for surgery. They were seeing longer hospital stays, particularly after surgery. I think a lot of these things were put down to more lifestyle medicine. The health coaching was brought in to support with that.
Since coming to you, I've managed to lose, like in total, I've lost 4 stone. Obviously, I know you remember when I first come to you, you always tell me that I said I'd never do exercise, and now I go to Zumba twice a week. I've got a boxing machine.
So health coaching is so important because it's a completely different approach. It's empowering people, it's increasing their health literacy, it's giving people the skills to help themselves.
I feel better in myself, and it's just, I'm so thankful for this service. People at work have said to me, I seem so happier.
I'm hoping to just like ace it and get straight through, have a couple of nights in ICU and go straight to the ward, is what I'm hoping.
The Stroke Bridging Service was funded by NHS England through Squire, which is the Stroke Quality Improvement Service. Prior to the Bridging Service, if somebody has a stroke within Bucks, they go to the early supported discharge team for 6 weeks. Then if they need further rehab on from that, they then have approximately 4-month wait until they go to the community neuro rehab team. The aim of the Bridging Service was to bridge the gap between those two services to reduce the wait for the stroke patients within Buckinghamshire, so people were able to have a seamless recovery journey for their stroke, which is something that we haven't had before in Bucks. We had the privilege of being able to work on things that were really important to the patients, like walking the dog. We were able to get some of our patients writing again. Some of them were able to use the computer. We had a young lad who was able to get back to playing the piano, getting out on a bike. All things that were so important to the patients. We've got 65% of our patients back to work. Over 70% have shown an improvement in their stroke recovery and their quality of life. We've reduced the wait through the funding by 50%, and we've been able to reduce the amount of onward referrals to the community neuro rehab team because patients have achieved their goals.
I became a grandfather in December, and I've been able to hold the baby. And at one point I wouldn't have been able to do that.
The main benefits of BadgerNet is that we are doing a massive reduction in paper of around 95%. This means that all our data is going to be in one place and easy to collect. Previously we've struggled to get data from community because it's all been on paper, so it's going to help us build a health inequalities dashboard that we will use to track our outcomes and our complication rates a lot closer. All your information is one place, so it gets rid of that paper as well, so the women aren't going to be holding their big chunky purple folders anymore. They're going to have all their information on one app, and it's called Badger Notes, and we help support them with the use of that as well. We are also running a side-by-side project with the Good Things Foundation, and it's all around digital inclusion, so we're able to gift free SIMs and free devices to women for the duration of their pregnancy to make sure that they have access to all this information and that they're not left behind. Badgernet has really helped us as midwives to be able to provide care to women. We have all the information right there, and it also supports our women to be more involved in their care, so giving them that empowerment.
It's very easy to follow and easy to use, so if you have forgotten something such as, you know, when your next appointment is booked or what was discussed at the appointment that you just had, you can literally just flick onto the app and find out what was said.
Nursing for care leavers post the age of 18 isn't typically funded through the NHS. The Children Looked After nursing team here at BHT thought creatively and reached out to Q Exchange, and we were awarded £40,000 to run this pilot transition nurse project from November of last year. The Staying Close project has now worked with 50 care leavers across Buckinghamshire, and we are really trying to promote a flexible and proactive preventative health service for them in the community. So really allowing the care leaver to recognise what their health needs are and be able to support them to access the right services for that. Not only providing that health support to them, but also enabling them to recognise who is the right professional to go to and how to go about that as they move into adulthood. The project has shown really great successes, both from the young people and from multi-agency professionals who have worked alongside the care leavers and the Staying Close project.
For somebody like me with ADHD, learning difficulties and so on, having that one point of contact is another stress relief. I think when you're dealing with the NHS, there's so many different professionals involved. For an average 21-year-old, they have mom and dad to do that. Because of Nelly, I'm able to coordinate my care in such an easy scaffolding way that it doesn't collapse me.
What we hear a lot is that care leavers are extremely grateful for being able to have a central point of contact, one person in the health system who they can turn to easily and flexibly, who can then support them with their health, who isn't restricted by time limits on appointments, who can visit them at home or out in the community where they feel most comfortable. And being able to do that enables them to feel listened to and heard, and then helps them to build confidence to manage their health more independently.
Just a taste of how we're changing the way we work at BHT to meet the healthcare needs of our residents and communities. Throughout all the digital innovations and new ways of delivering care, our amazing colleagues, volunteers and partners are constantly learning and adapting to make sure we continue to provide the best possible care 24 hours a day, 365 days a year. We want to celebrate our BHT family and all who support them and say a massive thank you.
Okay, so, general meeting. Be watching. Hopefully we'll continue to